Listen up, folks. Today we're talking about our ears. We have Dr. Jennifer Derebery with the House Clinic in Los Angeles. And ears are something we just take for granted. You know, it's such an important part of our hearing, but we just don't pay attention to them. So let's start with just talking about kids, because kids have so many different problems growing up with infections and things like that. What is the age range when kids start having issues?
The worst time for ear infections for kids is between birth and 2 years. And then again, you start to see another spike at around age 5 or 6.
Why is that?
They don't have good immune systems. They're not that healthy. And then the eustachian tube is what's supposed to regulate the air in the middle ear. It doesn't fully develop until they're 16.
Is there positioning or anything you can do to help alleviate some of that?
There really is. If you're with the children, when you're feeding them, put them upright. You're on an airplane, you're flying with them, let them sit upright. When they lie down, the eustachian tube will collapse, and that's when they're more prone to get problems with their
laying
ears.
in bed with bottles and things like that.
Bad idea. Well, that gives me business, so.
Well, you don't want that.
No, I don't want that. I have kids, so.
Dr. Derebery, this is personal to me because I have a daughter who's had ear trouble all her life. She's had 5 surgeries. My question is, it's heartbreaking. Is there something that we missed? The doctor said she was born with this inner ear tumor. Where did we miss it, or what should I have been looking for?
You didn't do anything wrong. There could be just a genetic mutation, and we don't know why that happens. Is it environmental, luck of the draw? There's nothing you could have done to predict that or prevent it. At this point in time, we can't do that.
Are there? I'm sorry.
Go ahead.
Oh, are there any symptoms that would separate it from a routine ear infection as opposed to something more serious? If it goes on too long, or anything that would stand out?
If you keep getting recurrent ear infections with your kids, or you've gone to the pediatrician and had a couple of courses of antibiotics, it's not better, go to an ear, nose, and throat doctor and get a real good exam and get an idea if there's something else going on.
So that's maybe in your
Right,
case.
because with my daughter, she's gone to 4 or 5, and every 2 years it literally comes back, and she has to have another surgery. So I'm pleading to you, if you can tell me, should I be paying attention? Now, we did know when she was swimming, that's when it flared. So should parents be concerned about their kids in the pool, or because every 2 years we have this situation?
Well, I'm trying to figure out what kind of tumor she has, if it's a keloid in the ear canal or something we call a cholesteatoma, because they're different growths, not cancer. We don't see much cancer in the ear, but it just depends where it is in terms of what you need to do for follow-up.
I think it's more of a keloid because it's now grown on the outside. So it was inside and it closed up her hearing, and then when they removed it, it's on the outside. So it resembles a keloid, but it's very, very painful. Sometimes she can't go to school.
Sometimes you're better off taking the skin out of the ear canal, literally just taking it out and putting a graft in, just getting rid of the bad skin. If it keeps on coming back again and again, she really might need something like that to cut it down more to the chase. And sometimes you have to drill down the bone in the ear canal to give more room. So, again, there's some more drastic things that might take care of the problem.
But the reason why I'm asking, because the doctor said she may go through this with the rest of her life. And I don't understand that as a parent. I don't understand, with all the technology we have in medicine, why my daughter may have to have surgeries every 2 years.
That's unusual.
We're going to figure that out.
I'll leave it at that.
But, the hard thing, what she was saying, it's just so heartbreaking with kids and the issues that they go, and they take it for granted. So especially like teenagers, they're listening to their loud music, and you just know, they're going to pay for it.
They have their earbuds on and you can hear it. That's scary.
But so how bad are the earbuds? Because I always worry about that.
It's a good question. I'm going to give you a statistic that's probably going to shock you. 1 out of every 5 adolescents has hearing loss now. That's greater than we have in the adult community. And when we look at these kids that have hearing loss versus those that don't, they don't report any more frequent iPod using. So there may be other things. There may be concerts, the loud music. We did, at the House Clinic and Research Institute, we did a research project a couple of years ago. We took 30 healthy adolescents, normal hearing, took them to the Rihanna loud concert. 75% of those kids had measurable damage to their inner ear after a single concert. They wouldn't wear the earplugs we gave them, they refused to. And had that concert been a business where their parents were attending, OSHA would have shut it down after 15 minutes. It was so loud.
Oh my gosh. So, are concerts regulated for the noise levels?
Absolutely not.
They're not.
They're not regulated for noise. They would never allow those levels in industry.
And so a lot of times you have those, sound engineers who are probably suffering from hear loss themselves. So they're like, turn it up, hear loss,
Yes,
The
they
louder
do.
the music, the nicer the party is what they say.
Yeah, I really feel strongly about that. It's just there's no excuse for it. You can have a loud concert experience without it being dangerous, and they shouldn't be doing it.
So once you do have some established hearing loss, like some of these adolescents do, what do you do? I mean, do you go right into the hearing aids? Does it matter how much the loss is? How do you gauge that and know that there's a serious problem?
You need to have a hearing test, and depending on the amount of hearing loss, they might need hearing aids. There's some online programs they can take to make them learn to hear sounds better. But the big thing is, if you stop the exposure to the noise at that point, it won't get any worse. You can't reverse what's
can't
there,
reverse
but
it.
you can stop it from progressing.
Well, we're not going to be able to get our kids not going to concerts. Should they be wearing the earplugs or something?
They should be wearing earplugs, and if they're really music, audiophiles, they can get custom plugs like we fit for sound engineers that don't distort the sound. But those little phone plugs are just fine.
Just make them cool looking, and then they'll
Yeah,
wear
I
them,
want to know
right?
why the schools aren't putting this in health class,
Yes.
as a part of a health
And I
program
was
with
gonna
education.
even ask you, and how important is diet and exercise? Because you think about your ear, we think about our weight, but what about to the ear? How important is diet and exercise to your hearing or your
It's
ear?
real important. If you go to societies like on South Sea Islands where they don't have industrial noise and they have low-fat diets, they have normal hearing their entire life.
All right, well, that's all we're going to be able to do for this, but thank you so much for giving those statistics out, and I'm sure that's something that, parents are going to start maybe removing those pods out or reducing the concerts that they go to. Thank you so much for Dr. Derebery for being here.
My
We'll be
pleasure.
back with more Every Way Woman.
Wow.